The chairman of a U.S. Senate committee says it will vote next week on holding the former White House chief medical advisor in contempt after a combative hearing. Dr. Anthony Fauci refused to answer more than 90 times during his testimony Wednesday, with questions ranging from basic awareness to policies. He was called to testify about the origins of the coronavirus pandemic. Dr. Fauci has denied any accusations from Republicans on the committee that he concealed that information while leading the government's COVID response. In his statement to the Senate panel, Mr. Fauci claimed its chairman, Rand Paul, has a, quote, obvious obsession with prosecuting him. He said that he was advised to decline answering over any questions that over concerns that Republicans would use his responses to try to prosecute him for perjury. Now, before leaving office in 2025, President Joe Biden issued a preemptive pardon to Dr. Fauci, granting him retroactive protection from any prosecution. Here's a clip of this contentious exchange with Missouri Republican Senator Josh Hawley.
What day of the week is it today?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
What color tie are you wearing?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
What color is the carpet in front of you?
On the advice of counsel, I respectfully decline to answer based upon my rights under the Fifth Amendment to the Constitution.
Yeah, just a sampling of some of the exchanges there. We have our political panel with me tonight. Caitlin Bledsoe, Vice President of External Affairs at Americans for Prosperity, a conservative political advocacy group, and Joy Cheney is here as well, a Democratic strategist. Joy, just to start with you, I don't know how much of that kind of 3-hour hearing you watched there with Dr. Fauci, essentially, taking the fifth on every question. Some very contentious exchanges there. What was your reaction to what we saw today?
I mean, it's par for the course. Look, this is political warfare. He is being attacked for political reasons, not for really any substantive reasons. And he is under no obligation. He's given enough to the nation. He's under no obligation to help political enemies, attack him. And so I think he did the right thing by, pleading the fifth, if you will. It's not quite the right term for Congress, but, to refusing to answer some of the questions and some of the silliness that you all just saw were hijinks. And frankly, it's hijinks that both parties have engaged in. And frankly, unfortunately, it doesn't serve the American people. This is not something they care about. What they really care about are how their health care is being impacted by this current administration. 8 million people have lost health care.
Caitlin, what were your thoughts and what we saw there today?
Yeah, I mean, outside of his opening remarks, that's certainly the quietest I've ever seen Dr. Fauci. Look, the bottom line is the diaries don't look good. The hearing did not look good. What's really at stake here
We should explain. So I think his diaries were actually subpoenaed, I suppose, by Rand Paul, weren't they? And so released publicly.
Correct. And that really was the inflection point for the hearing, because what's in those diaries are concerning. I mean, it really does. It's hard to know what he said privately versus what he said publicly. And that's why Republicans are demanding transparency. They're demanding answers for the American people, because ultimately we need to restore power and trust into the institutions. We're at an all-time low in that.
We heard Caitlin there say, Joy, that, that was the quietest we've heard Dr. Fauci. And, he basically refused to even answer basic questions we heard there. What color is your tie? What day of the week is it or whatever? What do you make of that strategy?
I mean, that's a tactic. I mean, so if you say you're not going to answer some questions, then you just don't answer all. That's just how it works. Okay. If you look at other hearings where witnesses have decided to not engage, that's how they do it. So, to the extent anyone in America or around the world is really looking at this and caring a lot about it, they should know that. And I think they will remember that. This is silly. Like I said, I'm going to repeat it again. 8 million Americans have lost either their Medicaid or their ACA coverage.
But there were a lot of Americans that also lost their lives, right, during the COVID pandemic. And,
yes, many fewer than Dr. Fauci saved millions and millions and millions of lives. He's generally perceived as a hero. There's a lot of distrust about, the COVID pandemic was unprecedented. And I'm sure there are things that he would have liked to have done better. I'm sure there are things Donald Trump would have liked to have done better. This was a really difficult thing. People did the best that they can. And so, Monday morning quarterbacking, you can find something in someone's statement that you find concerning. But what's not concerning, we came through it in part in great part due to Dr. Fauci.
You used the word silly, and Caitlin, I mean, there were a lot of really interesting exchanges between Dr. Fauci and some of the lawmakers, Republican lawmakers there. Josh Hawley, we heard some of them in that clip, but Bernie Moreno from Ohio using some very strong language, some expletives. What do you make of this kind of back and forth? I mean, is that an appropriate way to try to get to the bottom of whatever questions they might have?
Well, I'm always pro-civility, and, with all due respect to your comments, I mean, we lost 1 million lives with COVID, and I think that's why this is so heated. And so when we're reading comments in these diaries that are talking about what looks like and appears, and someone might take, that he's very obsessed with media, he's very obsessed with his relationship with Trump and celebrities, that's not what we expect of public officials that are dealing with such a crisis. And I think it's just what we need to get out of this for the American people is, if God forbid something horrible like this happens again, we have to have the trust in our officials that they'll handle it appropriately. And that's the biggest question.
I agree with you there. The only thing I will say is one of the reasons I think he was very focused on his relationship with Donald Trump is without having a close relation to the president, I think he was concerned he would not be there to do the appropriate things he needed to do. I mean, look, I don't want to go back to that period. We had a president who was kind of meandering. I know he says he was being sarcastic, but there were people throwing out things like, UV lights and disinfectant, and maybe you could take that to cure the COVID vaccine. So he was alarmed by that and wanting to be in place. And so in order to be in place, you have to make sure you have a relationship with the president and that you are presenting it in a way that the American people can receive. I think public health is not just about medicine, and science is also about how you communicate. And I think there are a lot of questions that we can review from that time, things that have come out about what the president may have known or doesn't know or said privately versus publicly. 1 million people died, but millions more were saved.